And send us live then.
Okay, go for it. Good afternoon. Welcome to this month's Research Matters. I am Erica Salzik, and I am the Department Administrator for UT Southwestern's Human Research Protection Program. Before we jump into today's presentations, here are some general housekeeping items. Next slide, please. First, if you have any questions for our presenters, please type them in the Q&A. One of our monitors will respond to you during the session, or we will address it at the end of the presentation. Second, the Research Matters session is being recorded, and it will be available immediately after the conclusion of the live session. You may access the recording by clicking on the same link provided in the Outlook appointment. Shortly after the conclusion of the session, we will send out any slides and or handouts via the listserv. You will also be able to access the recordings and documents on HRPP's Research Matters website, which can be found under the Training and Resources page. Finally, we provide a certificate of attendance to those who have logged in using a valid email address. This email will be sent separately from the listserv email and will only be sent to those who have logged in with a valid email address. As always, if you have any questions, please send an email to hrpp@utsouthwestern.edu. Next slide, please. So today's agenda, we have several things. The first thing we'll talk about are the HRPP updates. We will begin with those, followed by a presentation on how to avoid common pitfalls in clinicaltrials.gov, and then a presentation on expedited reviews. So next slide. So Josh.
Thank you, Erica. So just some quick updates. We don't have a lot to announce this month, but I do want to let everybody know that Sandra Marones, who we brought in from Radiation Oncology earlier this year, was hired into the Senior Regulatory Analyst position that we had announced previously. If you look at her right now in Teams, it'll still show that she's a regulatory analyst because this change will be effective as of next Monday. We're very excited for this change for Sandra. Some open positions that are still available on the website, one that I think is being posted, but just be patient with us. There's a regulatory analyst, and I'm just being specific about where these regulatory analysts live within the office. So there's a regulatory analyst position on the investigator relations team. There's two regulatory analysts, one or both that are on the analyst team, and one of those I believe is one that's pending being posted, but it will be posted soon. There's a regulatory analyst position open on the SIRB/Reliance team. And currently there is a regulatory monitoring analyst position that is on the monitoring team that is open. We do anticipate some other positions being posted within the HRPP soon, so keep an eye on the UT Southwestern career pages if there's any interest in moving over to the HRPP. Next slide. And with that, we'll turn it over to Erico and Razija, who are going to be talking to us today about the common pitfalls in clinicaltrials.gov. Thank you.
Thanks, Josh. Sorry, can you hear me all? Okay, so good afternoon, everyone. I'm Eriko from Regulatory Support Office. So I work with Razija Nambiar to support clinicaltrial.gov reporting. So we have been doing a how-to series in the previous Research Matters. So I talked about how to do the registration and results reporting. So we have step-by-step guidance documents, decision tree, those are all available in our website. We also introduce our free consultation services, which we provide one-on-one training and assistance on registration and results reporting. Then we talked about how to do the annual updates, then how to do the record updates. So you can check the previous Research Matters slides and recording for more informations. So in this month and in the next few months, we will be talking about how to avoid common pitfall. And then we want to provide you the tips and recommendations to avoid major comments. So which is basically a stipulation from ct.gov and at NIH, so reviewer at NIH. So let's get started. Okay, so one of the most common problem is the late registration and results reporting on the ct.gov. So as you know, so each ct.gov reporting activities such as initial registration, results reporting, annual updates, record updates have specific required reporting timeline. So if you don't meet those timeline, your study become non-compliant and study will be flagged as a problem record in the system. And your record and your name will be showing up on the non-compliance list, AKA the blacklist, which are reviewed by our leadership monthly. And if your study is audited by FDA, you will be receiving notice of non-compliance, and responsible party, so the PI, will be personally responsible for the civil monetary penalties. And so institution will not back you up on this. So you do not want to miss the deadline. So our recommendation is to initiate the ct.gov registration at the time of EIRB submission, as it can take up to 10 hours according to NIH, and start the results reporting at least 3 months prior to the due date. Again, it can take up to 50 hours for complex trial with multiple outcomes. So this shows that EIRB study activities, sponsor investigator, IND, IDE related activities, and ct.gov reporting timeline from the perspective of the study team and investigator. So hopefully this helps you and your PI to understand the timing of ct.gov reporting responsibilities. And also I want to emphasize here is that timing of these activities are almost exactly in parallel with IRB activities. So anytime you make actions in EIRB, such as submit modification, CR, reportable event, you should think about ct.gov reporting activities as well as IND, IDE maintenance activities. So the next common problem is incorrect registration and results reporting due to inappropriate delegation of scientific sections to unqualified staff. So I've mentioned before, but according to Deborah Zareen, so she's the former director of ct.gov at NIH for past 13 years. ct.gov registration and results posting are scientific tasks rather than administrative tasks, requiring basic statistical and epidemiological knowledge, especially for the results reporting. So at the time of results reporting, ct.gov requires summary aggregated data to be reported in a very, very specific way, depending on the clinical trial design and the assignment of the intervention. So also important to note that many ct.gov reviewers at NIH are clinical scientists with extensive statistical trainings. So many of their stipulations are scientific inquiries. So it is just simply very difficult for a study coordinator, unless they have a similar scientific background, to interpret those scientific inquiries. So task force recommends the PI, COI, or clinical scientists, including epidemiologists, biostatistician, to complete the scientific sections and addressing scientific inquiries. Or so study team member who has or who will be generating table 1, table 2, consort diagram. So typically it's figure 1 of the manuscript for that trial to do this task, because ct.gov results and manuscript result must match, because journal editor will be verifying the information in these both places. So the next problem is raw data are being lost or not available to do the ct.gov results reporting. So, so we understand that some of the data have been destroyed based on the data management plan that were submitted to the IRB. So we recommend that you include specific data management plan for ct.gov reporting in the protocol when your PI is developing the protocol. And then the fourth problem is investigators list exploratory outcome as secondary outcome in the IRB protocol. So as you can see in this table, so the primary outcome and secondary outcomes are required to be reported in the ct.gov, while exploratory outcomes or tertiary outcomes are not. So say if you list like 40 outcomes as secondary outcome in the protocol, those 40 outcomes are required to be listed at the time of ct.gov registration. And you know, it can be a lot of work, as ct.gov reviewer requires detailed information for each outcome. So you can't just, you know, cut and paste from the protocol most of the time. And also by the definition, you know, secondary NIH's definition, secondary outcomes are outcomes that may or may not be related with primary outcome, which investigators are interested and then committed to measure. But the study is not necessarily powered for the secondary outcome. And exploratory outcomes include outcomes that may or may not be available or meaningful. Right, so in the protocol, so it's totally reasonable to list one primary outcome, which is the endpoint for which the trial is powered for, and maybe pick one or two important secondary outcomes, and then list rest of the outcome as exploratory outcomes. So that's just our recommendation. So the fifth problem is protocol does not have sufficient information to allow for ct.gov reporting. So whether or not responsible parties, so PI delegates ct.gov reporting tasks to other scientific member, typically protocol doesn't have enough information to do the ct.gov reporting. So these are ct.gov registration required information. So we recommend updating your protocol template to include this information if PI plans to register the trial, and then especially if PI plans to delegate ct.gov reporting to other scientific members in the study team. So that they can cut and paste the information from protocol when doing ct.gov registrations. So these are the first 5 common problems and our tips, so the recommendation to avoid pitfall. So now let's quickly review the metrics. So according to FEDA non-compliance tracker website, UT Southwestern as a whole, our compliance rate proportion was 68.2% in 2020. So UT Southwestern leadership was obviously very concerned at the time. So with everyone's effort, we made 100% compliance since beginning of this year. And then we are going very strong. We have been keeping 100% compliance since this beginning of year. But again, important to note that this 100% compliance is for FEDA, so FDA regulated applicable clinical trial results only, doesn't include registration or other annual updates. Also, it doesn't include NIH funded trial that are not FDA regulated applicable clinical trial. Also, it doesn't include trial that are voluntary register. So this one we develop is basically shows the overall real-time compliance for all UT Southwestern record. So blue is the total number of record, green is the record without any issues, and orange one are the either study team is working on the record or records are under ct.gov review. And the red ones are the non-compliance one. So the red is bad. So this month we didn't have any of it. So thank you for all your effort. So here's the contact person. And here's a selected resource. So if you have any question, just email us. Thank you.
Thank you, Erica. Very useful and informational as always. And we'll just take a moment to switch our slides. And if you have any questions, please put them in the Q&A. That looks great.
Thank you. Good afternoon, everyone. I'm Satish Virla, one of the staff member in HRPP office, and today I'm going to discuss about Today I'm going to discuss about how to do expedited submissions in EIRB. So expedited doesn't mean faster. It means it is one of the IRB review types, and it does not require convened or full board IRB review. So what is the process of submission of human subject research in EIRB? The first thing is you will create a new study in VLOS, and you will update a new status in VLOS for IRB submission review. And once it is updated, it will go to the study in draft mode in EIRB. So where you can upload all the required and appropriate documents in EIRB, and you can validate the smart form pages and everything you can do it in EIRB. Once everything is done, only the PI can submit the study. The principal investigator can only submit the study in EIRB. Once it is submitted, it goes to the department chair review, and the department chair review approves it and sends it to IRB review. So in IRB, we have a pre-review process where we can review and we can look for the IRB review type, whether it is expedited, exempt, full board, or reliance, or single IRB study. And then it can go to designated review process, or it can go for a convened board meeting process. After that, we will issue an approval process where it has so many other layers in the approval process, as you can see in green light submission in EIRB. If you have any questions on this, you can please raise your question in FAQs on the chat itself. So here is the agenda for today. We will see what is expedited review and what is minimal risk, and we have different types of categories and some of the examples where you can see what is expedited review, and we have frequently asked questions where we will get so many questions during office hours or during emails or any kind of platform, and I can take the questions after my presentation. So what is an expedited review? Expedited research activities present no more than minimal risk to participants, no greater than those encountered in daily life. So in all these, I don't understand what is this expedited research activities. So the key word is minimal risk. We will go from there. What is minimal risk? So as you know, Office of Human Research Protection and the Federal Food and Drug Administration regulations define minimal risk as the probability and magnitude of harm or discomfort anticipated in the research are not greater than or themselves than those ordinarily encountered in daily life or during the performance of routine physical or psychological examinations or tests. Oh my God, this is a big thing. I don't understand what you're talking about. So I can give you some of the examples. What are those minimal risks? So study poses no more than minimal risks that are expected in daily life, like a small blood draw, a physical exam, or a routine psychological testing. That's a minimal risk. Or non-interventional studies like behavioral studies or nutrition-based studies, or whether a survey or a questionnaire. If I ask patient to complete a survey, then that's a minimal risk. Or any kind of electrophysiological studies like ECG or EEG, any kind of Doppler, those kind of minimal risk. Or genomic studies, or non-invasive imaging studies, research where involves collection of data, documents, records, pathological specimens or diagnostic specimens to understand basic biobehavioral processes. These are some of the examples of minimal risk. So here is a question for you guys. You can put it in the chat as a question or anything. So an investigator wants to do a study on pediatric patients that involves an MRI with contrast. The patients must be sedated for an MRI. So do you consider this is a minimal risk? I'll give like 2 minutes just for your answers. I don't know. I can't see your chat, so you can put where you want.
So far, no takers on responding. But if I see a majority, I'll let you know.
Be brave. That's okay. You can answer. I know you guys know more than this.
Okay, I have someone saying it's not minimal risk.
Perfect. That's the answer. Yes, because this is research-driven sedation and contrast agents that do not meet the requirement of definitions for minimal risk. So here is a slide which I took the screenshot from the ERB website. So I'm going to review what are the categories of expedited review. So a research project can be considered for expedited review if it is no more than minimal risks, fits into an expedited category, includes appropriate consent process or consent waivers if applicable and approved by an IRB. So we'll go to the category 1. So under category 1, we have approved drugs or devices, clinical studies of drugs and medical devices only when condition A or B is met. The B is in the next slide. So I'll go with A. Research on drugs for which an investigational new drug application is not required. So here are some of the examples, like a placebo-controlled randomized trial of aspirin alone, or NSAID alone in determining the effects of pain relief in adults because of aspirin and the non-steroidal inflammatory drug. These are already approved by FDA, so it does not require any other IND application, so it can be considered as expedited categories. Trial of a prototype toothpaste on dental plaque or gingival inflammation, or comparing two non-prescription over-the-counter artificial eye drops, those which does not require IND application. So these can be considered expedited review. Here is the second, category 1 for the B, research on medical devices for which an investigational device exemption application is not required, or the medical device is cleared or approved for marketing and in accordance labeling. So the example might be examining the difference in metatarsal or phalangeal joint motion with and without a motion extension carbon foot plate, a shoe inserted place inside the footway and prescribed for patients with hallux rigidus as part of their standard of care. So this carbon foot plate extension it is a device. It's not a medically indicated. It's a standard of care. It's not research driven. So that's the reason this can be approved as expedited research. So the second category is collection of blood samples. So we have two types in the collection of blood samples, where healthy non-pregnant adults who weighs more than or equal to 110 pounds, the amounts withdrawn is less than or equal to 550 ml in 8-week period, or collection is less than or equal to 2 times per week. So the example might be a one-time blood draw of 2 tablespoons from healthy subjects who is an adult, like more than 18 years of old. So here is the key. Consider the amount of blood to be drawn within the total required of both clinical and research purposes to ensure an accurate determination of risk, whether an expedited review is permitted or not. So you always consider in your study the amount of blood drawn for both research and the standard of care should be less than or equal to 550 ml in 8-week period. So that's one of the biggest thing where we will consider based on amount of blood drawn. So the next one is who are not normal or healthy adults, like other adults and children, persons who have not attained the legal age of 18 in Texas. Considering the weight, age, and health of the patient, the amounts to be drawn is less than or equal to 50 ml or 3 ml per kg in 8-week period. So these might be any kind of patients who has a definitive diagnosis, or any kind of children who did not attain the legal age, and collection might be less than or equal to 2 times per week. So a one-time blood draw of 3 tablespoons of blood to study markers in adults and children with hemophilia can be considered as research expedited research category under section 2. Next slide. Okay. So the next one is category 3, collection of blood sample other than blood samples, like prospective collection of biological specimens for research purposes by non-invasive means. So the non-invasive means procedures include but are not limited to, like vaginal swabs that do not go beyond the cervical OS, or rectal swabs that do not go beyond the rectum, and nasal swabs that do not go beyond the nares. So these can be considered as non-invasive means, and here are some of the examples of those, like hair and nail clippings, deciduous teeth at time of exfoliation, or if routine patient care indicates a need for extraction of the tooth, permanent tooth if routine patient care indicates a need for extraction, excreta and external secretions like sweat, uncannulated saliva collected either in an unstimulated fashion or chewing gum base or wax, or by applying a dilute citric solution to the tongue, placenta removed at delivery, or amniotic fluid obtained at the time of rupture of the membrane prior to or during labor, or mucosal or skin cells collected by buccal swabs or skin swab or mouth washing, sputum collected after saline misnebulization. So the next category is collection of data through non-invasive procedures, which do not involve general anesthesia or sedation. These are routinely employed in clinical practice, excluding procedures involving X-rays or microwaves, which do require radio frequency. That's the reason medical devices must be cleared or approved for marketing. Here are some of the examples, like physical sensors, which may be applied on the surface of the body, or weighing or testing sensor acuity, or MRI, magnetic resonance imaging, or ECG or EEG, thermography, or radioactivity of detection of naturally occurring, electroretinography, ultrasound, diagnostic infrared imaging, Doppler blood flow, echocardiography, and moderate exercise. These are some of the examples under the category 4. So So let's go for category 5, use of clinical data. The data might be involving materials that have been collected or will be collected solely for non-research purposes, like from the electronic medical records, the documents, records, or specimens. These can come under category 5. But due to new common rules, some of the research in this category may be exempt under the regulation of HHS for the production of human subjects, 45 CFR 46 101B4. But this may be reviewed by IRB, and we will give you the definitive answer for this, whether your research can be an exempt or expedited review under this category. Data from recordings. Collection of data from voice, video, digital, or image recordings made for research purposes. Like an example, a researcher wants to do a skin reconstruction project on burn victims by taking and using photographic images to predict their prognosis. A researcher wants to audio record the patient and physician assistant conversation to determine the effectiveness of patient education. So this can be considered as expedited review because they are just collecting the audio and video recordings. That's the basis for this. So the next category is category 7, surveys and interviews. We have research on individual or group characteristics or behavior. So if it is research on perception, cognition, motivation, identity, language, communication, cultural beliefs or practices, or social behavior, then it can go under category 7. Or research employing like survey, or conducting an interview, or conducting with a focus group, or taking an oral history, by doing a program evaluation, human factors evaluation, or quality assurance methodologies can be considered under category 7. So let's do quite a few examples whether this research can be expedited or not. So here is my first example. A study of social functioning in clinical stable outpatients with schizophrenia includes a comprehensive assessment of psychiatric symptoms and interpersonal relationships in a 3-hour interview-based assessment. A psychologist who conducts the interview. The procedures are divided into 3 one-hour sessions with breaks. So do you consider this is an expedited review or not? You can put it in the chat. I'll just go ahead with my presentation, but it's just for your reference as an example. Yes, we will consider this as expedited category 7 because the study population undergo psychiatric assessment as standard of care and are familiar with this assessment. So the risk is considered as minimal and research category qualifies for expedited review. So here is the example 2. Nursing home staff interview patients to complete a brief self-report scale measuring mood, anxiety at baseline, and 2 weeks after music is played nightly in patient rooms on half of the wards. All subjects are informed that a study of the effect of music is planned and music is played only in the rooms of those patients who agree to the intervention and ratings. So do you consider this is expedited or not? Yes, it is an expedited review category under category 5 and 7. This intervention involves the manipulation of the subject's environment and the collection of data using a self-report measure of mood and anxiety. The intervention is benign and the methods of collecting data are consistent with the minimal risk criteria. So the risk is considered as minimal and the research category qualifies for expedited review. So here is the example 3. Healthy adult subjects are asked to take part in 2 visits of 2-hour-long assessments of memory, attention, and information processing speed before and after 1 hour of cognitive enhancement exercise using specially designed computer software. The procedures are conducted during a single visit and subjects are encouraged to take breaks when desired. So, do you consider this as expedited review? Please put it in the chat. I'm not going to wait for the answers, but I just wanted you to have the fun. Yes, this can be an expedited review category under 7, surveys. The intervention in this example requires healthy adult subjects to take part in a 5-hour research study in which the benign behavior intervention lasts for 1 hour and the data collection lasts for 4 hours. So this would definitely meet the definition for minimal risk, and the research qualifies for expedited review. So here is one more example. A researcher wants to study cognitive response by performing computer games with healthy adult subjects for 8-week period of an hour session each. Recordings of blood pressure and pulse are obtained along with the collection of a saliva specimen for the measure of cortisol level from adult subjects in a study linking psychological arousal to cognitive performance on a standard series of computer games. Do you think this can qualify for expedited review? Because they are collecting so many things. I don't know if you can see the question. Okay. Yes, it can be an expedited review category. 3, 4, 5. The computer game intervention is brief and is likely to be benign, depending on the content of the games. There is a depending on the content of the games. That's the keyword here, because we always see the sensitive information for IRB. So please make sure the sensitivity matters in all these different category types. But the collection of blood pressure, pulse, and cortisol data would be considered medical interventions with the data collection. So the risk is considered as minimal and the research study qualifies for expedited review. Let's do one more example. This will be final. Sorry for this. A researcher wants to compare and collect the data from Fitbit versus an Apple Watch at a healthy club where 50 normal adults are asked to participate in a study looking at the impact of a 2-hour session on the benefits of exercise. Randomization is done between the two groups of 25 each. One group receives the Fitbit and the other group receives the Apple Watch. Participants are provided with a free Fitbit and iWatch and then asked to come to the club every other day to have a reading taken on their daily steps as recorded on the smart application. I would like to be in this part. I can get free iWatch if I'm, so I'm just messing it. It's a joke, sorry for that. So do you consider this as an expedited review category? Please guys, answer. I wish this is in person. Okay. So yes, this can be considered expedited review category 4 and 6 because collection of data from digital and non-invasive procedures recordings like Fitbit and Apple Watch is considered minimal and research study would qualify for expedited review. So some of the additional examples like randomly assigning participants to different FDA approved drugs, both approved for a particular medical condition, to compare their effectiveness. The keyword is FDA is already approved the drugs and they are using for exactly approved use. So that's the reason it can be considered as an expedited review. Collection of an additional bone marrow specimen from patients during the bone marrow biopsy scheduled for clinical purposes. So here they are doing the bone marrow biopsy for standard of care procedure. So that's the reason it can be considered as expedited review. Asking participants to view disturbing images while undergoing an MRI. So we all know MRI can be considered as expedited review without the contrast and without the sedation. So this qualifies for expedited review. Collecting information from women about use of illicit drugs during their pregnancy. So this can be considered as expedited review because they are just collecting the information whether they are using any kind of drugs or not. They are not giving the drugs, they are just collecting the information on the pregnant woman, whether they are using any kind of drugs or not. So that can be qualified for expedited review. So if you are giving an additional drugs, then we need to review the entire study. So it depends on the study itself too. And the next one, a study that will involve whole genome sequencing in infants, but the results of the sequencing will not be shared with the families. So here the keyword is the results of the sequencing is not shared with the families. So results of those genome sequencing they are not sharing. So this can be considered as expedited review. So we do get a lot of frequently asked questions like, can my study be considered as exempt or expedited? So we cannot give you a definitive answer for this because we don't know the full information. So when you contact HRPP office or staff or reviewer, we need to know the entire study, what are the research procedures involved in those study, and then only we can give the definitive answer on those questions. So like, can informed consent be waived for an expedited review study? It depends on what kind of expedited review study you're doing too. So please provide all the information before you question, you inquire about your queries. Or can information sheet be used for an expedited study? Even this has the same response. It all depends on what type of study and what type of risk level the expedited study has and whether you can provide information sheet or not. So the information sheet is a kind of a small description about the study where you will give it to the patients whether they want to participate in the verbal consent during the verbal consent process. So it all depends on the study. And the next one is, can I submit full waiver of HIPAA authorization for an expedited study? So this also depends on the type of study what you're doing. So can I submit a modification for my existing expedited study to collect more tissue specimens like nasal swab, blood draw, or rectal swab? So here the keyword is, we do not know on your study how much blood collection you are already doing it. So we need to know more information on how much blood collection is going on and how much additional blood collection you want to draw from the patients. So that's one of the biggest things. So when you ask a query, you need to provide all the information so that we can give much more definitive response. And the last one is, do I need to submit a continued review or an annual update for my expedited study? So after the new common rule came into existence, some of the studies can be submitted as annual update. So it also depends on the study, what type of expedited study we approved it during the initial review. Some expedited studies may have went into the convened IRB because of the risk level. So it depends on what kind of study also. So we cannot give you a definitive answer. We need to know all the information before we provide you the definitive answer for this. So please contact HRPP office if you have any questions of these kind, and we can give you the response based on the study review, what it is and what's going on in the study. So I can take the questions now if you have any.
Thank you so much, Satish. That was a lot of information and great examples, and it was a little bit of fun this time around. If you have any questions, please put them in the Q&A. We'll give you a few moments to type out your questions, as we understand there is a small delay. Let's see. I have a question. Maybe you can answer it, Satish. It says, can I use an information sheet with a consent?
I need to know more information on why you're using the information sheet, because you already have the informed consent where you can provide complete information. So why do you need an information sheet? So this depends on the study itself too.
Yes, a lot of these questions probably have an answer of depends. And
Yeah.
just give us a call, right? If you have any
Yes,
questions.
give us the STU number for the study, and then we can review it and we can give you the definite answer for that.
Great. So far, that was the only question. So I'll give you a few more moments, but just wanted to thank you all for attending today's session. The next Research Matters session will be held on December 14th, which is actually the second Tuesday of the month, not the third because of the holidays. Let's see, there is another question. Let's see if you can answer it. It says, so would retrospective chart review studies fall in the exempt or expedited category?
If the research procedures are only belong to retrospective chart review or prospective chart review, all you're doing is collection of data, can be considered as exempt categories, section 4. So I need to know more information on what kind of research procedures you're doing. So if it is just the collection of the data from the EPIC or medical records, then it can be considered exempt category 4.
Okay, thank you. Let's see.
If you see my slides, I have categories like 3 and 4 or 3 and 5 for some of the examples, because we can have those like multiple categories in one study because of the research procedures involved in the study. So let me know what kind of research procedures are there in the study, and we can give you the answer for that.
Thank you. So far, I don't know if I see any other questions, but if once we hang up, you guys can still add your questions in the Q&A and we can answer them even after the session is over. Again, thank you so much, Satish and Erico, for your presentations, and we will see you all next month.